Question number 166. Certain formed elements are paired with their functions. Select the one with incorrect pairing. Basophils secrete antibodies. This is incorrect because basophils secrete histamine, heparin and serotonin. Antibodies are secreted by plasma cells. Option 2. Platelets help in blood clotting. This is correct. RBCs transport CO2. This is correct. RBCs help in the transportation of both oxygen and carbon dioxide. Neutrophils engulf bacteria. This is also a correct pair because neutrophils are phagocytic cells. The incorrect pair is option number 1 and correct answer to this question is option number 1. Let's move on to the next question. Question number 167. Which of the following cardiac events results immediately after the QRS wave complex in a standard ECG? And the options given are option 1, the tricuspid and bicuspid valves open, option 2, ventricular systole, option 3, blood from vena cava is forced into atria, option 4, the ventricles relax and the semilunar valves are closed. Just after the start of Q wave, ventricular systole occurs. So correct answer to this question is option number 2. Let's see other options also. Option number 1, the tricuspid bicuspid valves open. This is incorrect because at this time AV valves are closed. Option 3, blood from vena cava is forced into atria. This is incorrect because at this time AV valves are closed. Option number 4, the ventricles relax and the semilunar valves are closed. Again, this is incorrect because at this time ventricles are in contraction stage. So correct answer to this question is option number 2. Let's proceed to the next question. Question number 168. The cardioinhibitor area in medulla oblongata of the brain. First option increases the rate of heartbeat. This is incorrect because this is inhibitor area. Option number 2 increases the cardiac output. This is also incorrect. Option number 3 decreases the rate of heartbeat. This is correct. So correct answer to this question is option number 3. Option 4 increases the stroke volume. This is again incorrect. Correct answer to this question is option number 3. Let's move on to the next question. Question number 169. Medicines given to dissolve clots or prevent clot formation in some cases of myocardial infarction include all except. And the options given are streptokinase, penicillin, TPA and heparin. Streptokinase is a clot buster. Penicillin is an antibiotic. So, it does not dissolve clots. TPA, tissue plasminogen activator, is also a clot buster. Heparin is an anticoagulant. It prevents clotting of blood. So correct answer to this question is option number 2. Let's move on to the next question. Question number 170. Choose the mismatched pair with respect to one cardiac cycle in a normal quiet setting. Time of one cardiac cycle is 0.8 seconds. Atrial systole occurs for 0.1 second. Ventricular systole occurs for 0.3 seconds while joint diastole occurs for 0.4 second. Now let's see the options. First option, atrial systole 0.3 second. This is incorrect because atrial systole occurs for 0.21 second. So mismatched pair is option number 1 and this is correct answer to our question. Joint diastole 0.4 second correct, ventricular systole 0.3 second correct, one cardiac cycle 0.8 second correct, and correct answer to this question is option number 1. Let's move on to the next question.